Infection prevention is pretty much in the name. We want patients to come into the system and leave in a better situation. So what we try to do is optimize their care, and we try to optimize the protocols that the nurses and physicians are implementing, just to make sure that they're higher standard.
It is literally the mitigation of risk, right? It is protection of our patients. We have a unique way at looking at processes, procedures. We are like a medical detective.
What people don't know is from the time you enter the front door of the hospital, as a visitor, as a patient, as any type of guest, infection prevention has played a very important role in making sure that it is a safe environment for you.
We look at everything from, of course, where the trash is located, hydration stations for the nurses, making sure that there's no cross-contamination with regards to OSHA. So once they're dealing with the patient, making sure that when they go back to take a drink or eat, that they're not causing harm to themselves. So we don't just look at patients, but we also look for employee hazards.
We go to the kitchen to make sure that the food that you're eating is safe.
We look at everything from products, different equipment that comes into the hospital, making sure that it can be safely cleaned.
I think it's important for us to be there to provide that type of feedback, to make those recommendations to keep us safe. I mean, even with like COVID, we've been dealing with this for quite some time, and it's not going away. And so what can we do to mitigate the risk as much as possible?
The COVID-19 pandemic put our department on the map. Prior to the pandemic, no one really understood our work. They just thought we were the hand hygiene police. It took a disaster and something so profound as a pandemic, in which people relied on us really filtering through the guidelines from Dr. Fauci and the Centers for Disease Control, and them being concerned with how this is affect me and my family and my life and my patients.
My dad was one of the first COVID patients in Florida. It kind of solidified my decision to do infection prevention. I knew that if I had not been in infection prevention, I would not have had that relationship with the ID doctors in Georgia for them to be able to consult with the ID doctors in Florida to save his life.
It only takes one entry point for an infection to happen. We are essential to healthcare as a whole because we are there to identify the gaps and create interventions to close those gaps.
The biggest reason I got into public health was being able to serve those and advocate for those that are not able to advocate for themselves, and that's another reason I love Harris Health.